Mauritius, Dr. Tedros Ghebreyesus, DG of the WHO, Honorable Professor Mohammed Ali Pact, Coordinating Minister for Health and Social Welfare, Republic of Nigeria. We would remain standing as our dignitaries and as observe the Ghana National Anthem.
Abusia ha Kempinski Gold Coast Hotel na neyekoso wa hane se Ghana Mampani His Excellency John Mahama, the Commander-in-Chief of Ghana Armed Forces. One Africa mpanifo ahodo ebi fi Nigeria, ebi fi Rwanda, chese baby bebre yoma kamotama ba no se baby. Kamia ye se 1957 independence a Ghana je no. Africa for dodo na de omho afia kwasikoko nsem so still na no kamia ye se yegusu adan omo ni titru a fire pomudin ensem hunti no and I'm so ama omo de Africa Health Sovereignty Summit acheche so a omo hwe se ewom se Ghana ene Africa ha ye wosika de ye neoma abrofo no so ya asene de nanso no enwo behia se yankasa ye befa ye health sector no e de abo yebo ni yankasa yetimi ehu kwan ye befa so na yetimi ahwama abibifo ye di apomudin na enhu hia se bibia na ye ko ni akodan enye Microsoft pani ni sika wode beba na malaria etimi abopane a na ye ko hwehwe obi foforo Rockefeller Foundation ni ade ehu behia se nyina ebe kan ho abom na afi yetimi ahwe kwan ya befa so ama omanfo ewa bibire mu ha no omatimi ade omho efa apomudin enhu enti enam so amoma kom ho abomu a empanifo ahodo oma behia na omokomtie ku na ahwe kwan a ye betimi agina so ni yankasa yenhia se kwasikoko be ma yiska ansan yetimi abo ya pomudin eho brabusua mienko na yenko tie sene enkomo no koye ha Ghana News TV so medin enna na sefa hwen bobo na mesrɛ se ne ndiri kan aba hwemia na subscribe na wa share video e de ama me sanso na me kai wo se wo amanone na wo se send disk ba o my Ghana mu a omode an download the lem file na fa send the bra unim se dollar no sisi a Ghana cedi na ebro no pa nanso wo ba lem file so a eho no wo benya kwense dododo nti wo send a wetimi asende kama pa sanso obetimi asende akọ nipa na bank account obetimi asende akọ ni mobile money munti wo Europe dia wo download the app na no match ye 10 euros a share ho sanso na send first 100 euros a on bet 15 euros na dia share ho se wo US Canada ene ne importam so na dollar na send e na no so no what wedi wo download the first download na wo news ni share mu an wenya $10 a share ho wo send first $100 a no match $20 and no crowd betimi asende am obi as airtime where nani beji amwada wase pa abusua mienko yentie Ghana ye health minister Yeru Akwabena Minta akando seni odi nanu dusem etudwa e odwumedi na asem
even when the budget is tight. This is what we mean to do, because when health is financed wisely, it always pays for itself in increased productivity, stability, and improved quality of life. Let us remind ourselves that this summit is not a mere meeting. It is a living initiative. We have a space for shared learning, open challenge, and collective ambition. It's a historical opportunity to co-create and shape the architecture of our health governance. We have the knowledge, the experience, and the wisdom in this room. Our challenge is the courage to act together. As I close, I return to the proverb that guides us. He who has health has hope, and he who has hope has everything. Let us give our continent everything it needs to hope again. We must close not with declarations, but with fierce, actionable commitments that ensure our dignity no longer depend on the generosity of others. Let us build a future where our investment, innovation, integrity secure the well-being of our children. Ladies and gentlemen, the task is immense but not impossible, because the most radical act in global health today is simple: to believe that Africa deserves better and to build accordingly. May we rise to the responsibility history has placed on us. I'm grateful for the opportunity.
Our friend Mark Daibo, Michelle Sidibe, Edem Aziogonu, and Archbishop Duncan Williams. Now, this had happened just after the events in America where the USAID office was shut down, and America announced a suspension of USAID programs. And so, even though the issue of health sovereignty and domestic financing of our health systems had been an issue of discussion for several years, that event made it even more urgent. And so Baba had dragged all these people with him and said, we need to hold a conference and put some more urgency into creating resilient, self-sustaining, and self-reliant health systems. And so that is how come the idea of this summit was born. And so President Obasanjo, Archbishop Duncan Williams, Michelle Sidibe, Mike Daibo, Edem Aziogonu, and all of you who gave birth to this idea, I want to thank you. It's because of you we're here today. I want to thank the DG of the World Health Organization for leaving everything and coming to join us. His presence lends importance and urgency to the subject that we're discussing here. And he said something. He says the difference between crisis and opportunity is leadership. And so I think that as leaders of Africa, we must take the bull by the horns and lead this conversation and ensure that we're able to build more resilient health systems. My sister Amina, who hosted me when she was president of Mauritius, I want to thank you for coming, and my mother, Johnson Sirleaf, former president of Liberia, I want to thank you also for coming, Minister Pate, all the ministers from Guinea-Bissau and other countries who have joined us today. I want to thank you. In the holding room, I was discussing with Director General Tedros, and I was talking about President Ruto having invited us to come and understudy their primary health care system. And it turned out that the technical assistance for setting up that system came from the World Health Organization. And so immediately, Director General Tedros offered that he would send his technical team to come and work with our Ministry of Health to set up our own primary health care system. So I want to thank you in advance. There's a story of my father's friend who went to a friend to borrow his car. And he went to ask him to buy him a car. And when he went with goats and sheep and guinea fowls and came and said, I came to thank you in advance for the car that you have agreed to buy me. So DG Tedros, in African tradition, I've thanked you. And so we'll expect your technical team to come and work with us to design our own primary healthcare system. I believe that this would help with preventive health system and create a more resilient health system for us. So I want to thank you, all of you who have taken time, Victor Bampo, Nanoye Bampo, and all of you who have made this possible. I want to thank all of you and all those who have traveled from near and far to join us. Thank you very much. So without wasting any more time, Your Excellencies, Let me begin by offering you a heartfelt akwaba, and that is a warm welcome to Ghana, the land of freedom and justice, and the proud home of Pan-African aspirations. We're not gathered here today by chance. We're here by conviction, shared purpose, and a collective refusal to accept the limits imposed on us by an outdated global health order. We're here because we choose to lead reform, to heal, and reimagine what our healthcare systems can be. This summit comes at a time of overlapping and intensifying global crises. We have wars, we have pandemics, we have climate shocks, we have economic volatility, and widening inequalities. And these are not just testing our systems, indeed they are exposing where the fault lines are. The world has changed, but global health governance has not kept pace with the changing world. At this moment, we're called to redesign the architecture that has for far too long excluded Africa's voices, excluded Africa's needs and innovations. We're called to build systems that do more than respond to crisis. We must build systems that generate resilience, produce equity, and amplify dignity of our people. Let me be clear. We've seen profound global health achievements over the past decades. That is true. And let us honor those successes. For instance, child mortality has been halved since the 1990s. Maternal deaths have dropped by over 40% since the year 2000. Over 29 million people now have access to life-saving antiretroviral treatments. Millions are living longer and healthier lives due to cleaner air, better sanitation, and innovative health systems. These gains have not been by accident. They've been the fruits of bold partnerships like Gavi, the Alliance for Vaccination, the Global Fund, PEPFAR, unfortunately, that's part of the program that has been canceled under USAID, and many others. But even as we celebrate, we must confront the truth. These gains are now under siege. In 2023, global development assistance declined sharply, and Africa felt the shock. Immediately, maternal health programs halted, vaccine supplies delayed, and medicines disappeared from the clinical shelves. In Ghana, our community-based health delivery model, which we call the CHIPS compound programs, was brought to its knees by abrupt funding withdrawals. The ripple effects were felt all across our country, from Dodowa to Damango. This is not merely a funding gap, it is a crisis of imagination, a vacuum of solidarity, and a deep failure of shared responsibility. Above all, it is a question of the sovereignty, the right of African nations to determine their health priorities, marshal their capacities, and lead with their own vision. And so out of adversity comes opportunity. Africa must no longer be the patient. It must be the driver. It must be the author. It must be the architect and the advocate of its own health destiny. Let us remember that Africa is not new to global health leadership. When HIV and AIDS ravaged our continent, African leaders like President Olusegun Obasanjo and the late Kofi Annan of blessed memory helped catalyze global responses that birthed the Global Fund and Gavi. When Ebola struck West Africa, President Ellen Johnson Sirleaf and her colleagues became a moral compass for the conscience of the continent. During COVID-19, President Cyril Ramaphosa rallied the African Union into collective action on vaccine access. Today, President William Ruto is leading the charge to eliminate malaria as a continental scourge. Today, President Kagame is the African champion on domestic health financing and is leading advocacy in building resilient, self-reliant African health systems. We've built enduring institutions like CDC, Panabios, the African Medicine Agency, that are not merely bureaucracies. These are symbols of an emerging African health ecosystem that is rooted in digital innovation, it is grounded in data, and designed for self-determination by African countries. Your Excellencies, ladies and gentlemen, here in Ghana, we have not stood still. We have uncapped our National Health Insurance Scheme financing, opening a fiscal space of about 3.5 billion cedis more for broader and deeper health coverage. We've launched the Ghana Medical Trust Fund, otherwise called Mahama Cares, a sovereign innovation mobilizing public, private, and philanthropic capital to tackle chronic disease burdens like hypertension, diabetes, and kidney failure. Our launch of our primary health care program in the coming months, along with the recruitment of community health volunteers, will improve the general health and wellness of our citizens, marking a significant step forward in preventive care. And that is where DG Tedros has promised to help us. But let me share one real-life story. And this is of Akosua, a young mother in a town just not too far from Accra called Dodowa. She survived childbirth complications because the CHIPS compound she attends was digitally linked to a regional hospital. And so in real time, she had a real-time referral system that saved her life in childbirth despite the complication. A digital prescription platform ensured that she received the medicines that she needed without delay. This is not a vision of the future. It is present reality of health sovereignty in Ghana. We're not merely reacting to emergencies, we're building systems that create jobs, reduce inequalities, and uphold the dignity of every Ghanaian, no matter where they are. Health is wealth, and we must reframe the economics of well-being. We must reject the outdated notion that health drains our economies. In truth, health is the engine of productivity and bedrock of inclusive growth. The WHO has shown that for every $1 invested in health resilience, it yields up to $4 in returns. This return is even greater in Africa, where youthful populations represent latent economic dynamism. And so every malaria case that is prevented is a day of work that you have regained. Every maternal death that is avoided is a family that continues to remain stable. Every vaccinated child is a future you have secured for your nation. We must therefore urge our ministers of finance, and I'm sad our Minister of Finance is not here, to treat health as a capital investment, to encourage sovereign wealth funds to allocate resources to biotech, to diagnostics, and resilient infrastructure, to call on economists to revise national accounts to reflect health as productivity multiplier and not a consumption expense. And so I suggest that we act decisively at 3 levels. And the first one is that globally, we must champion a new health governance architecture that reflects a multipolar, digitally interconnected, climate-challenged world. Health governance must be democratic, it must be just, and it must be fit for the 21st century realities. The second one is that regionally, Africa must scale up its homegrown solutions. The Africa CDC, the African Medicine Agency, the African Continental Free Trade Area Health Corridors, and the AUDA NEPAD Resilience Agenda. These are all things that we need to scale up. And then nationally, we must execute not merely plans. This requires political will, domestic resource mobilization, and as DG Tedros said, effective leadership. So success is going to depend on our scaling innovations like PanaBios for digital health verification and pandemic preparedness, Proper for transparent medical supply chains, and BioNovac to transform vaccine production from molecules to the market. And what are the new commitments? Today I'm pleased to announce 2 significant commitments. The first is the Presidential High-Level Task Force on Global Health Governance. This will be a convening platform to engage global and continental partners to redesign the health governance systems for the world we live in now, not the world of yesterday. The second The second will be the launch of the Sustain Initiative, and this means scaling up sovereign transitions and institutional networks. This is a bold African-led platform that will align our national budgets with our health priorities, will mobilize sovereign, diaspora, and philanthropic capital into our health systems. It will foster cross-border learning, innovation, and accountability. And I extend an open invitation to all nations represented here to join us in building an African health investment ecosystem that is driven by purpose and is powered by equity and anchored in our sovereignty. And so, to conclude, the Accra Declaration for Health Sovereignty that we are discussing in this summit is more than a policy forum. It is a moral call to action. It is a strategic milestone and a continent-wide awakening. And I wish to thank all those who have stood with us in this journey: the Afro Champions, the African Union, the Rockefeller Foundation, the Georgetown University, the Obasanjo Foundation. Your partnership reflects the new multilateralism the world needs, grounded in co-creation, not extraction, and based on mutual respect for each other and not charity. In a world where floods erase borders and disease do not need passports, we must remember one truth: that in the face of suffering, we are all human. In the face of suffering, titles disappear. There are no doctors, there are no watchmen. What remains is our human dignity. What remains is our solidarity and our shared resolve to protect life. Health is not a luxury. It is the foundation of our freedom. It is the currency of our dignity, and it is our greatest public good. And so let the world hear this from Accra. Africa's pain is not a deficit. It is a death of perspective. Africa's healing is not a plea. It is a rallying cry for sovereignty. Our sovereignty is not isolation. It is co-creation. And so together, what should we do? Let us reset the moral compass of global health. Let us build systems that generate wealth, uphold dignity, and expand purpose. And let us not only reimagine our future, let us own it. And let us make our systems more resilient and self-reliant. And so I thank all of you who have come to join us. And from Accra, we say, let Africa rise and take advantage of the opportunities available. I thank you, and God bless us all.
Warriors here, this is Gungulum, 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 Gung. This is Ghana News TV. The time is 6 o'clock. Let me follow. Ghana.
So send this cafe amanoni aba Africa ha. You should fight. Say ye fear wo pese won tono. You should fight. E dan ya na say Japade a wani da so a pese oto Africa ha no. You should fight. So wo send this sika amodofo e de aboa no Africa ha. You should fight. Sanso e na say uti obi school fees amano a. You should fight. Yenti a make cancel lemfi ama on say utimi send this sika e fa lemfi so a e mani begu bank account mu. Sanso e na timi begu mobile money account mu. Enu achi nso no de bia lemfi e wo daily rate a e ma hu sika dodo a wo send a wo benya. Lemfi e secured. Na wo send this car enche na nipa wo send ama no ne nsa aka. Lemfi wo USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal, and France. What the Lemfi send this car? Untu ahwe. Bomodian dey use me code NEWS news. Na say any day they can register or Lemfi so a unya bonus. Sanso and I use chance so a ye wo bonuses ahodo a ye de ma.
Follow and watch Ghana News TV.
Thank you for being here. When we have a problem and the world health situation today is problematic, I believe it is the responsibility of leaders not to just wring their hands, but to stand up and do something about it. And President Mahama, that is what you are doing. President Mahama, that is what you are doing. I will also want to thank President Kagame, who has been spearheading African health, financing, architecture, and infrastructure. I want to thank Prime Minister Gordon Brown for giving support and going along with us on this journey. It's not going to be an easy journey, but it's a journey, if I may say, that has precedent. We have been in very critical health situation in the past. We had Ebola. We had HIV/AIDS pandemic. We had COVID-19 pandemic. But we rode out of all this. And the way we handled HIV/AIDS in particular should give us something to cheer about, something to give us hope, and something that can lead us to where we need to go in the fractured global health situation that we are in now. I don't believe that I need to belabor the situation that we are in, but I believe what we need is solution. How do we move from the present to the future, immediate future, of hope, of confidence, and of health security for all? Let me start at the family level, family and community level. I believe that we need to do more with traditional medicine. I was in a meeting not too long ago, about, 15 years ago. And the meeting is about afforestation. And when I got there, the people I started seeing were people in pharmaceutical. So I thought I was in the wrong place. When I went to them, I said, look, we are here for afforestation. Why are you here? And they said they were in for afforestation too. And they told me and said, 80% of the drugs we buy in the pharmacies have their origin in herbs. And what is happening is that these trees are being cut, they are being destroyed, and they have not extracted enough from the herbs. I learned a lesson from there. So the herbs that we have in our villages and rural areas are useful. And even the pharmaceuticals of the world have 80% of what they sell to us having their origin from herbs. At the family and community level, we can use more herbs than we are using traditional medicine. At the national level, I believe that there's virtually no country in Africa today that doesn't have health insurance in one form or the other. We can expand and enhance health insurance. And 25% of our health insurance fund can be used to manage our health architecture and go into health infrastructure. At the continental level, just as we have now risen to have a peace fund, and I tell you what that peace fund has started to do. When I was appointed Special Envoy for the Horn of Africa, and I was handling the situation in Ethiopia, AU was waiting for European money before I could start, or American money. Today, 5 of us have been appointed as facilitator for DRC and Rwanda. Immediately, AU made available $1 million out of peace fund. That is progress. I believe we can have a health fund for Africa. And this health fund can be managed by Africa Development Bank. And the source, to start with, something like $100 for flying into Africa or flying out of Africa, but not for traveling within Africa. And then, of course, we can see what else we can do to enhance that fund. But we need health fund for Africa. Global, I believe at the global level, we should have health security for all. Health security for all. Here in this country, some time ago, the slogan was Ghana beyond aid. I believe the slogan for us should be now Africa health without aid. But with global partnership, solidarity, cooperation, and collaboration, and of course, togetherness. Because pandemic, as we have seen, knows no geographical boundary, knows no borders. We have to work separately and together for security for all, health security for all. Thank you.
So send this cafe amanoni aba Africa ha Usulemfi. Say ye fear wo pese wo ntono Usulemfi. Edan anase japade a wani da so a wo pese oto wa Africa ha no Usulemfi. Se wo send this sika ama odofo e de aboa no wo Africa ha Usulemfi. Sanso e na se wo tie obi school fees ama no a Usulemfi. Nyenti a make camful Lemfi ama on say utimi send this sika e fa Lemfi so a e mani begu bank account me sanso e na timi begu mobile money account me. Eno achi nso no de bia Lemfi e wo daily rate a e ma hu sika dodo a wo send a wo benya Lemfi e secured na wo send this sika enche na nipa a wo send ama no ne nsa aka Lemfi wo USA, Canada, UK, Italy, Germany, Ireland, Netherlands, Spain, Belgium, Portugal and France. What the Lemfi send this sika untu ahwe Bombardier they use me code NEWS news. Na say any day they can register or lemfa so a unya bonus. Sanso and use to chance so a ye wo bonuses ahodwa ye de ma.
Me no makwekwe sa sempa kania. Se menam na meti asempa na mo amane a na ma no keka me. Anyam bia what ANS Trading Agency Limited nka. Se wo ka se door to door for no de na e watwa. E sense obi ne wa wo se wo ho sa door to door business nim. Wo nneoma wo UK a wo de ko Ghana. Ana se Germany a wo de ko Ghana. 3 to 5 weeks e be kwa kodu nipa ne puna no se try. Na de mo demonstration wo se adwuma de we mu ne se wo ho bo no. E da form se boko. ANS Trading Agency Limited. E wo air freight special service. And nneoma ne ye de be fa plane. Entintempa na akwa kodu. Obetima for South Power we also the new free Ghana, Aqua UK and Germany. FAGG them, which is also in a year. I mean drop a bomb. ANS Trading Agency Limited pair and a 40-footer any 20-footer container. FA UK Edico Ghana and Germany Edico Ghana. Oma Manuoma Yemre, import to export to them there for you. Omo Ghana Namani 0249 170 423. UK has over Freya 0790 802 7527. Germany 09173 771 2733. Ubenya ANS Trading Agency Limited. Our West Croydon ANS Trading Agency Limited. Quantum Brantem. Wana beboya baso. Maybe next time in your fill up from the bebro.